and every hospital is supposed to have every machine for test you upgrade.
Okay.
Every test, every machine is supposed to upgrade and know say yes. He just run go do it and come back.
Okay. So you need
Food now.
Yeah, what about the food?
The food is not 100%. The food and we get the food on time and everything in there, but there's a taste of the food and me know my food at home. And there's some nurse, and now like the nurse, very nice nurse. And if you come on to December time, you know, the time cold,
yes.
You have a nurse and she bathe me one time, she make sure I warm all the water, because the water cold. She warm the water.
Okay.
Excellent nurse, big up yourself nurse. And she like, just stay healthy, you know. Just check your health. Don't run on the wealth, just check your health, please. It's not a nice thing when you're sick.
In Office with Dr. Jevon Samuels.
Good day, viewers. Welcome to another episode of In Office. I am Dr. Jevon Samuels. Here we have in office with us today once more is Mr. Everton Hibbert.
Welcome.
Welcome back to the show, Mr. Hibbert. Alright, it's nice having you here once more. Alright. Today's discussion will be about hospital admissions, hospital and hospital admissions in general. Because my guest here today, in the past, he was admitted for 3 months. So he just wanted to share some of his experience with us, since not majority of the population in the world won't actually experience hospital admission. So this opportunity is a good opportunity to hear experience of how hospital admission work, prepared or be aware of stuff that will take place at the hospital. Now, a hospital is a specialized form of medical care in which it provides like hospital beds, which patient can stay overnight or can stay for days or weeks. So it provides what we call inpatient care. In comparison to like clinics or small type hospital, which may just provide like outpatient department only, which are normally referred to as clinics. Hospital admission for patients who are admitted to hospital tends to be patients with acute illness or may have some form of trauma, such as accidents or stab wound, gunshot wounds. Those are the types of patients that normally get admitted to the hospital. But have other acute illness, such as may have sepsis in the blood. One person may have a pneumonia. Some persons may have other illnesses that comes on sudden and requires hospital admission, especially if they have abnormal lab works in the emergency department or if they have abnormal vitals. It's now divided into different departments. So even for, you have the medical staff, which normally entails the doctors, which may be physicians or surgeons, and also the nursing staff, which will provide the nursing care for the patients. You also have additional supporting staff at the hospital, such as the dietary department. You have the janitors, which usually cleaning. You have porters for the transport patients from one department to the next or to get their imaging. And also, you normally have a transport department for each hospital, especially if the patients have to be transferred to another hospital or for outside services that the hospital may not provide. Now, a typical patient normally is admitted from the accident and emergency room. Say, for example, someone is in a motor vehicle accident or they get a gunshot wound. They may be rushed to the emergency department in their private vehicle or via an ambulance, and normally have a triage nurse in the emergency department, which would do the initial vitals and checks. Then you have the accident and emergency physician would normally do an initial assessment of the patient and make the necessary decision. So some patients are treated in the emergency room and may be sent home, especially if they don't require hospital admission. Others may be admitted, and it can be a surgical admission, it can also be, or it can be a medical admission. So typical medical admissions are persons that may have like seizures, heart failure, which are decompensated, pneumonia, and sickle cell painful crisis. And we have also persons that may have missed dialysis and coming with fluid overload. Those patients are example of persons that would go to the medical ward. For surgical patients, gunshot wound, motor vehicle accident, some person that will come to the hospital with severe abdominal pain, which could be what we call acute abdomen, which could be like appendix, etc. It would go to the surgical ward. Persons that come in with like infected wounds, like diabetic foot, etc., would also go to the surgical ward. And specialized hospitals, you might have the surgical department is broken down into subspecialties. You may have the neurosurgeons, you have orthopedic surgeons, you have the urologists, and ophthalmologists, ENT specialists. Those are different surgical subspecialties which will get surgical patient. The medical department may also have subspecialties. You have the cardiologist, you have the neurologist, you have the infectious disease specialist, you have the endocrinologist, and for example, you might have hematology department and the hematologist as well. That would basically give a summary of the medical, the surgeons and physician aspect. But in terms of the nursing staff are normally staff that responsible for taking like the vitals from the patient, the blood pressure, the pulse, respiration, etc. And also to administer most of the medications and to basically observe the patients and throughout their hospital stay. That would be the mainstay for the nurses, and give both the IV and IMR, so that the intravenous, intramuscular, or the oral medication. The nurses normally will administer those medication and chart them in their medication cards or records. The dietary department is also an interesting department. Hopefully, my guest here today will talk about the dietary department. Some hospitals might have fancy food, some hospital food might not be as tasty as they should. Sometimes the food may come late, sometimes it's on time, sometimes it tastes good, sometimes it does not. Also, you have the interaction with the janitors, which it's a hospital setting, so someone is always on the floor doing stuff, and if you know experienced janitors, they imagine you're cleaning and persons, staff and patients are constantly walking in what you're cleaning. It could be discouraging from the janitors as well. Alright, and the porters normally there to give a helping hand to transport patients, to turn patients on bed, to move patients from chair to bed, etc. My guest here will share with us today his experience. He was admitted for 3 months at hospital for infection in the blood, sepsis. So your turn, Mr. Hibbert.
Yes.
And welcome back to In Office, alright?
Yes, alright.
A pleasure having you here.
Yeah. It started from a Friday evening. I got to the hospital and I was feeling some pain. And I get an injection. And I'm sending back home on Friday. But I go back home Tuesday on the dialysis. But I find myself feeling more pain. I can't even walk.
Okay.
So I have to lift me up, put me in the taxi. Take me to the hospital. Alright, and then run some tests on me in the hospital.
You remember the type of test that they did that was from in the emergency room?
Yeah.
They did blood tests.
Blood tests.
Did X-ray.
Yeah, and then the X-ray.
ECG.
Yeah, everything. ECG, blood test, and run through the test. Then.
Yes.
Alright, and so I put on water. That's from June, July, August, I think until September.
You were in, so basically 4 months.
Yeah.
3 to 4 months
3
you
to
were
4 months,
admitted.
right.
Alright. So what was your experience like initially, like for example, the first week of admission in terms of your interaction with the doctors, the nurses, and plus the support?
The first week was very excellent. Doctor run some tests, X-ray. Maybe every 2 days or 3 days and do an X-ray, and the doctor tried to diagnose what because the fistula was infected.
Okay, and the fistula is what the catheter is getting dialysis.
Yeah, the catheter infected. And the fistula now, we just did the operation and put in the fistula. So the blood infected, I'm weak, can't walk. So them start treat me. IV in my hand, them have a medication, antibiotic them give me.
Yes.
Every day.
Every
two
day.
times a day.
2 times per day.
So sometimes them can't find vein. In the last half, them have to put down the grind side right so.
But the access?
Access.
Put in
Access.
Okay.
For run the antibiotic.
Okay. I think that's a central line.
Right.
Okay. But that's what that normally we have difficulty with getting access.
Right.
Because
Because
the central line.
whole of my hand. Remember this actually 4 months later, so the whole of my hand, the vein, them can't find the vein. All of them black up.
Okay.
Alright, so it was alright so far, but and then the first half now we admit. We go to the optometrist.
Ophthalmologist.
Eye specialist. And feel my hand swell, heavy like anyway, looking to the eye doctor and she had test me. We something burst.
Where something bursts.
Like a water does a drop. I don't feel it. I don't feel it. Maybe something just psh, and the water does a spray. And the doctor just grab on my hand, tie my hand, and burst. I don't feel that pain.
Oh, the fistula, the way they did the surgery there.
Right, but the fistula was alright.
Fistula was alright.
Yeah. And she called it emergency surgery and cut off my clothes off of me. I'm just trying to say wake up back in the theater.
So all this happened while you were at the hospital?
Yes.
Okay.
And them treat it and it's alright till we start using them take out the catheter. Until we start using physical and everything alright within the 3 months.
Okay.
So everything and the nurse them was excellent. One time we find a bad problem with them tested for TB. And the Friday.
So what you had? You had a chronic cough or the sauce?
No.
Sign of it.
Doctor said he should give something at the X-ray.
Okay. So they tested for TB.
So they tested for TB.
So normally when they are tested for TB and they suspect TB, we normally quarantine those patients and like isolate them in a corner. So probably that's the experience you're having.
Right, but them quarantine me, yes. But then they never did so excellent. But
in terms of what?
In terms of the nurse, I said, what the nurse said, it's positive. Which in that is the way the Monday before you know, because it's going to turn, if it turn red, it will turn that positive, but it don't turn. And the doctor said, don't scratch it, because it make it infected or make it change different color.
Okay, so that's the man-2 test.
Right.
Okay.
And she come back the Monday and everything alright. But then quarantine me in her room.
So they didn't do a sputum, test your sputum, like let the cough into a container
No.
like in the morning?
No.
They didn't do that. They didn't have any respiratory issues?
No.
Okay.
Well, otherwise from that, everything alright, excellent, very excellent. But the food now.
Yeah, what about the food?
The food is not 100%. The food and we get the food on time and everything in there, but there's a taste of the food and me know my food at home.
Okay.
But everything else is alright so far. And there's some nurse, and not like the nurse, very nice nurse. And it come on to December time, you know, the time cold.
Yes.
You have a nurse and she bathe me one time, she make sure I warm all the water, because the water cold. She warm the water.
Okay.
Excellent nurse, big up yourself nurse.
Good. She watching this video, she will know.
Yeah.
Alright. Alright, so apart from the one incident when you were isolated and they treat you like, because they probably scared themselves about getting infected with TB. Because I think it's a similar case to like the COVID-19. Whenever we have those patients, we tend to isolate them, so the staff themselves may be scared of picking up these infections. So probably the nurse may have just be scared of catching like TB and suspected that you might have it, alright? Apart from that, you had excellent nursing care, so you got the medications and time.
And time. Right through the night. Eye drops. I like right through the night we get eye drops. Like every 2 or every 3 hours, she have to come on eye drop me. And the nurse right through the night she had eye drop in the eyes.
Okay. So you said that the catheter was infected and the infection went in your blood.
Yeah.
And you were on antibiotics. So what they did a blood culture that they test the blood for germs.
Yes, then
Okay, and they had the IV antibiotics.
IV straight.
But normally, blood infection would normally clear up like within 3 weeks to a month. So that's a severe infection, but it spent like three
Months to 4 months.
So what was the explanation for that they gave you? Why were you not discharged earlier?
Well, they try to clear the infection first. Infection still in the blood.
Okay, so you don't have to get the initial course of antibiotics, you
Right.
still had infection.
Right.
But they did the repeat cultures
Yes.
and we're still sure.
Right. And then let me out. When they let me out, we still have to do one outside, do a blood test outside and carry the result to them and then check it and say, alright, still.
Okay. Alright, so in terms of the interaction with the doctors, they will update you and they
Yeah, man,
progress.
every morning they have 4 to 5 doctors come on and the senior doctor
Yes.
and the junior doctor them explain to the senior doctor them and tell them the condition, how we'll come on and tell them, read out everything to them.
Okay.
So that was excellent.
Alright, so you're admitted to the medicine department initially.
Yes.
And then you would have the nephrologist or the kidney specialist
Yes.
co-managing you.
Yes, come on.
And then you'd have general surgeons as well, okay, the surgery while you're in hospital.
Yes, so there were 4 different doctors.
Different team of doctors.
The team of doctors that visit me every morning.
Okay, alright. So in terms of did you have any interaction with like any of the janitors, the cleaning, they complain about?
No, they're alright to me now.
Yeah, okay.
Yeah.
What about the porters? They ask them to buy stuff for you?
Yeah, man, regular.
Regular?
Yeah, man.
I know the porters, they lose their job.
Regular. Janitor porter, they might know, man. Buy
Yeah,
things
yeah.
for you.
Okay.
I'm not buy water. Must mean water still.
Okay, yeah, but that's allowed still, water.
Yeah,
But
mainly
normally, like some hospitals, they don't allow like outside the food.
Food, yeah, but
Some
water-
taking KFC and
No.
Island Grill and so
Yeah.
forth. They don't really allow those stuff. They want to go a strict dietary diet, and
Yeah.
especially they want it to be balanced and also like nutritious drink. Because some persons don't
Yeah,
take
man.
in the soda and so forth, right? So in terms of interaction with other patients, I know that if you're in hospital for 3 months, I would assume that you have seen or heard of other patients
Well,
dying next to your bed and so
I can tell you this, the amount of patients will die around me.
About how many we're looking at over the 3 months?
About 8.
About 8.
8. I'm here, a patient is here, but the nurse them don't tell you the patient die now. Yeah, it's a red flag.
Red flag.
Yeah.
Oh, that's how they code it.
That's what they call it.
Okay.
And, you know, but you have a patient, I go in there to see him.
Yes.
I hear him say, I know him there.
Yes.
And he don't talk. But I need the nurse to talk to him and pay him a morning time.
Yes.
One day the nurse testing pressure and him say, how much it is? Ask the nurse.
Yes.
And that name died.
You died.
He died.
Yes. Sorry to hear. So, if patient die and you're in the hospital for 3 months, that's not a bad record for a medical ward, alright? And so were you like interacting or talking to another patient that died?
Yeah, man.
So what were some of the conditions that they had?
Same kidney failure. Some of them have cancer. Some have pneumonia. They have different kind of sickness. Some have.
Okay.
Men and talk sometimes. Some we used to carry around crackers and so some of them have a liver problem.
Okay.
Them bore them side, take the liver, the blood off of the liver and test it and so.
Okay.
I scrape the liver and test it. So me and them interact man. So me always have things like me always have a 2 or 3 couple bottles of water plus me have some crackers and some patients at the night.
Share with them.
Share with them, yeah. Them come and say give me some crackers. That I used to get the big crackers, the cheap big crackers them. And we used to share them.
Alright, so you're in the hospital for 3 months and patients would have died, and you said that one time you got so weak you were unable to walk. So at any point in the hospital were you like scared that you might die?
No. You know, say I have a friend come look for me and she tell me say, she says no like come look. So me I go down and she come back a couple of days after she said well, she feel comfortable now because she see me up now.
Okay.
But I don't have scared at all. I don't have scared over here.
Okay.
You know, now you see so much people there around you say, when am I time?
Yes, it wasn't the case like
No,
that.
sir. No, sir. I never feel that way there. Tell my body feel, you understand?
Okay, I always feel like you're in the
Yes,
experience.
right, because the when you just go in, I mean, the treatment going on, so
Yeah.
getting better day by day, day by day.
Okay.
Because I couldn't walk. When you just went, couldn't walk,
And then after how long you were able to regain your strength?
about a week.
Okay, so you're getting physiotherapy?
Yeah.
Okay, but physiotherapy is part of the medical team that
Yeah,
you
man.
mentioned in the earlier. So,
Exercise up a morning time to stand up and have a thing to make me blow up on it
okay,
and catch some breath and things. So everything was alright.
okay. And so in terms of your overall stay, I think it was a good a fair experience at the hospital.
Yes, yes.
So did you had gone to hospital which you had to pay, or one that was free of cost, or is one that they could have?
When I paid the bill, I didn't tell a bill. The bill is so high.
So you're probably still in debt from
Yes,
that time?
still in debt.
You still owe
Yeah, man, 2.7 million.
2.7 million?
Yeah,
They have to write down that money, Mr. Hibbert.
yeah.
Alright. So in terms of follow, so you're discharged, you got appointment to go back
Yeah,
to the
I'm
clinic.
follow it, right.
Okay, but they didn't like refuse to give you an appointment because you had outstanding balance.
No.
So you're still able to get the treatment.
Yeah.
Another thing I wanted to ask is that you're admitted for 3 months. How often were you getting dialysis while you were admitted?
Same time, 2 times a week.
2 times a week. So you're getting 2 times consistently.
Constantly, yeah.
Okay, so that aspect was not an issue.
No, that's not an issue.
So what are some of the changes you think that could take place in a hospital setting in Jamaica to make it more patient friendly?
First thing, if that admit you very quick. Because when you go to the hospital, from about 5 o'clock.
5 o'clock in the morning or
In the
5
evening.
p.m.
5 p.m.
in emergency room. So that's when you enter the hospital
Right. And
emergency
if I
room.
go on the ward until they can never see me until the next morning about 9:30.
9:30.
Yes, so on the wheelchair I'll sleep. The wheelchair I'm sleeping on.
You step in the wheelchair.
Yeah.
That must have been very uncomfortable to say.
Bad. Very bad.
Yeah, but
But
sometimes.
after that, everything excellent.
Okay, so when you went on the ward initially, you were able to get a bed at the same time.
Yeah, you have it at the same
Okay,
time.
because sometimes not all the time patients get bed same time. Sometimes you have to wait a day.
It's up here.
Good.
And I
Especially-
never bad luck to get that time there.
Okay, I will get a bed.
And-
Alright. From the lengthy stay in the emergency room, well, my counteraction to the lengthy stay in the emergency room is that seeing patient is not something that you can really rush. Because remember
Yeah.
that it's life and death. Alright, Mr. Hibbert, so, and normally when you go to the hospital, it's not a first come, first serve basis. It's not like it's KFC line,
Yeah,
get
no,
up the
yes.
line. It's critically ill patient first. So for example, if you go to the hospital, you get a gunshot, you get a stab wound in a motor vehicle accident. If those patients should come in, the doctor will have to leave patients that are not bleeding or not in severe pain and see those patients first. Alright? So
You know,
that may not be an easy thing to change
You know
for a
that.
non-patient.
I got to hospital already, you know.
Yes.
And like they shoot up a whole town,
Yes.
community.
Yes.
And the doctor come to me and I was there, I just said first come, first serve, no. And the doctor come to me and said, listen, we're trying to save some life now, so not just hold up for a little bit, please.
Okay.
And she come and explain to me. Yes, I did love that.
Yes, so probably communication, they have to communicate.
Right.
Right. And for example, sometimes, especially if a person going, like the referral is have to go to hospital for admission, they could probably just take something they can eat before they go, alright? So apart from the lengthy stay in hospital, what are some of the other means you think the hospitals could improve? Since you have admitted to more, even though you had a 3-month hospital stay, I know that you have admitted to hospital several times.
Yeah.
But are some of the other changes you think they could take to do to make the hospital more patient friendly?
I feel the amount of staff.
Think it's short staff.
Yeah, because you see the nurse now, when the nurse them short staff, then you call a nurse, the nurse don't want to come to you at the same time. And then sometimes I feel the nurse them feel say within themselves them overwork.
Okay.
And them can't have about 10-20 patients one time. So that's why we say them short staff.
Short staff. So
Yeah.
you think they need adequate staff at the hospitals?
Yeah.
Alright, so apart from the lengthy wait, adequate staffing, anything else, I think that you could recommend, probably health minister is listening to this video, you know, so anything else you would recommend from a patient? Because remember I'm a doctor here, you know, so sometimes I don't really have the experience as a patient.
Yeah.
It's a different experience from a staff to a patient. I am on the side of the staff where the stress is high, so probably don't have as good customer service all the time. But from a patient standpoint, I think we need more staff to have, especially in the emergency room, so we can decrease the wait time.
Yeah.
Alright, anything else?
You want more bed?
More bed space, and probably a bigger hospital for the ORs. I'm already full of beds.
Yeah.
Yes, anything else?
There's more bed space mainly, and more the extra them need to move. Every extra them need more work.
Like the CT,
You're right.
MRI,
Right.
imaging.
And everybody can go out the road and do them test. You understand? Every hospital is supposed to have every machine to test upgrade.
Okay.
Every machine is supposed to upgrade and know say yes. He just run go do it and come back.
Okay, so you need to get the image in a timely fashion.
Yeah.
Timely manner. Yeah,
Something that save life.
It save lives.
Yeah. Because people are waiting to go to test and then die. Doctor send them out to go to test. And you could have done the hospital at the same time and diagnose the problem. But then go be the
Machine not working.
Machine not working, but then accumulate the money to go to the test out the road, they know it's expensive. Then die.
Okay. Alright, but that's unfortunate. But as I said before, even like with your kidney situation, they still have to like even though some persons can get dialysis for free in some of the public hospitals, they still have to initially be to purchase the catheter.
Yeah.
See, you have any of your other fellow patients that had issues purchasing like the hemodialysis catheter?
Yeah, man. No fun people purchase it a road and carry it. Because when my catheter is changed, you know.
Yes.
I buy a purchase it a road, you know.
Like so the cost that you buy the catheter for
I
that
don't
time?
remember, you know, because I was in the hospital and the sister buy it out for me.
Okay.
And then send it up there with a beer.
Alright.
Then the doctor write the prescription and send it and then pick it up and then go buy it. And you know, then change it. And you know, then start use the fistula.
Fistula, okay.
Yeah.
Alright, so I know that we spoke about the things that we need to upgrade to do to improve the hospital and patient satisfaction, but what are some of the good stuff about the hospital that you appreciate?
I appreciate that hospital. Them change the sheet every morning. Love that.
Okay. Alright.
Every morning.
Change the sheet.
Right, and them come for me for the dialysis, no problem.
Okay.
Yeah, them do good. They have some very nice nurse, you know. Very nice nurse. I'm not gonna bash them. They have some very nice nurse. I want to say, I encountered in a private institution.
Yes? Oh, is there admitted at a private hospital?
No. What do dialysis?
Oh, yes. Whereby don't call any name
Yeah,
for this show.
yeah, man.
Alright.
And them treat more worse than and money we are paying so than the
Public
the
and the
public.
hospital.
Right.
Okay. So you still have positive stuff occurring, good stuff occurring at the hospital.
Yeah.
Right? Alright, so any final word for the viewers, Mr. Hibbert?
Yeah, well, just stay healthy, you know. Just check your health. Don't run on the wealth. Just check your health, please. It's not a nice thing when you're sick.
Okay. Alright.
Yeah.
Alright, viewers, so this concludes another episode of In Office. So remember to like, share, subscribe, and leave a comment on this video. Until next time, take care.
Be sure to subscribe for more informative contents on life, sickness, and death.